we've had on a couple of the most esteemed doctors in the world who are huge advocates of the keto diet. One of my most popular episodes I've ever had was with Dr. Dominic D'Agostino. And also, I recently had one with Dr. Chris Palmer, who's shown it can have huge positive impacts for mental health illnesses and disorders. But from your perspectives, what are the problems with the keto diet?
I'm glad we brought this up because a keto diet is it's a very popular dietary trend. And there's a lot of research that's evolving over the course of time because it's relatively new in the world of scientific research. And you're right, as far as the cognitive benefits are concerned, as far as the brain effects are concerned, a ketogenic diet was first discovered in the 1970s to be a tool that researchers use for intractable epilepsy, right? So kids that were having frequent seizures were given a ketogenic diet and it significantly calmed down seizure activity. And that's a really good thing because it enabled them to have a much more normal life. And there have been other research studies that have demonstrated that a ketogenic diet can have profound impacts on your brain to moderate neurological activity, to reduce anxiety, and to reduce depression, and to make you feel like you're living a more normal life, which is awesome. So I'm not going to take any of that research away. Okay. What we did in our book, Mastering Diabetes, is we wrote an entire chapter devoted to the ketogenic diet because the ketogenic diet is a very popular tool in the world of diabetes and in the world of weight loss. And there's a lot of questions about, is it safe? Is it not safe? Should I do it? Should I not do it? You say yes, somebody else says no. What am I supposed to do? I don't really know. So this chapter basically has over 150 references, and we basically go through step by step to try and understand what is a ketogenic diet? How can you implement it? What effects does it have on glucose metabolism? How does it affect your glucose? How does it affect your insulin? And what does the research say about its use in the short term and the long term? And to summarize that chapter in our book, which I highly recommend reading, is what I'll say is that a ketogenic diet is a very powerful tool for promoting rapid weight loss. Okay, you've probably seen this online. You've probably talked to other people that have gone through this before. You've probably talked, maybe a lot of your listeners are in the same situation. We start to eat a ketogenic diet and significantly lower your carbohydrate intake. You eat what's known as a VLCD, a very low carbohydrate diet, okay, less than 30 grams of net carbohydrate per day. And when you do that, you end up inducing a calorie restricted state without even trying. So you end up actually consuming less calories on a daily basis than you were in your previous diet. And as a result of that, that then starts the weight loss process. So people who eat a low carbohydrate diet or ketogenic diet end up demonstrating within the first week that they lost 4 pounds, 6 pounds. The first 4 to 6 to 10 pounds usually is mainly water, which is totally fine because the water is attached to glycogen. Glycogen is a storage form of glucose inside of your liver and muscles. It's very hygroscopic, meaning that one glycogen molecule attracts 3 moles of water. So therefore, it's a very highly absorbent material. So when you shed that glycogen because you're not consuming carbohydrate, then you end up shedding 3 times as much water, and that promotes weight loss in the short term. But then as you continue onwards, people end up losing 2 pounds per week, 3 pounds per week, 4 pounds per week. And before you know it, people who have been on a ketogenic diet for 3 months or 6 months end up losing 50 pounds, 60 pounds, 75 pounds. I've talked to people who have lost 200 pounds eating a ketogenic diet. And I would never deny that's a true statement. I'm not going to deny that in any way, shape, or form because it's true and it happens, right? But what I want people to understand is that just because you're losing weight does not necessarily mean that the thing that you're doing is actually going to benefit you in the long term, okay? And what I mean by that is a ketogenic diet induces a state of calorie restriction that then induces weight loss. And that's a good thing because when you lose weight in the short term, what you're likely to see is number 1, reduced fasting blood glucose. Number 2, reduced fasting blood pressure. Number 3, reduced fasting insulin. Number 4, you're likely to see reduced triglycerides. That's a good thing. Number 5, weight loss. Number 6, reduced A1C value. All of these markers of your basal metabolic function go up. So on a piece of paper, if you look at it, at time equals 0 and time equals 3 months, you're like, blood pressure improved, cholesterol improved, triglycerides improved, A1C improved, fasting insulin improved. Darn, you are doing a great job. Whatever you're doing, just keep it up. That's what doctors like to say over and over. But if you fast forward and you look at what happens over the course of time, okay, time is a vague statement in this context. Time could be 6 months. It could be a year. It could be 2 years. It could be 5 years. But if we fast forward to some point in the future, what the research demonstrates is that people who eat a diet that contains more protein, or like a significant amount of protein, greater than 25 to 30% of their calories as protein, and people who eat a significant quantity of dietary fat, especially saturated fat, which is very common on the ketogenic diet, have a higher chronic disease risk. I'll say that one more time. People who increase their protein intake and people who increase their dietary fat intake end up increasing their chronic disease risk over the course of time. And that's what I want people to understand, is that the stuff that happens in the short term looks good and it's fantastic and it shows that there's significant metabolic improvement. But in the long term, eating a diet that contains a significant amount of protein, especially animal protein, and especially a significant amount of saturated fat, can end up causing profound alterations to your glucose metabolism and profound alterations to your cardiovascular metabolism that can end up increasing your risk for many chronic diseases. And I don't want that, and you don't want that. So that's the sort of short-winded way of me saying I'm not a huge fan of ketogenic diets, even though they do promote short-term benefits.